Welcome back to the Dr. Pica podcast, where we bridge science, lifestyle, and motivation to help you live your best, healthiest life. Today, we're diving deep into a topic that's reshaping the way we treat obesity: the 7 FDA-approved anti-obesity medications. We'll cover how they work and who they're for, and also the key side effects you should watch out for. If you've ever wondered about names like Wegovy, Contrave, or Phentermine, this episode is for you. Let's separate fact from fiction and empower you with real science. So why do medications for obesity matter? Obesity isn't about willpower. It's a chronic, relapsing neurohormonal disease. Just like diabetes or hypertension, it needs medical management. Lifestyle, diet, exercise, mindset is the foundation. But sometimes biology fights back. And that's where pharmacotherapy comes in, helping to regulate hunger signals, fullness cues, and energy balance. And these medications are indicated for a BMI of greater than 30 kilograms per meter squared, or BMI of greater than 27 with comorbidities like diabetes, hypertension, or dyslipidemia. Now let's dive into the 7 main medications approved by the FDA. Phentermine. Brand names are Adipex P and Lomira. And this medication is a sympathomimetic amine, similar to amphetamines. It stimulates the release of norepinephrine in the hypothalamus, and thereby suppressing appetite. Now, you want to use this medication short term. Usually it's used for less than 12 weeks or so. And the average weight loss can be around 5 to 10% of a person's baseline weight. Common side effects are an increased heart rate or blood pressure, insomnia, dry mouth, anxiety or restlessness. So who should avoid this medication? Patients with uncontrolled hypertension shouldn't take this medication, heart disease or hyperthyroidism. Phentermine works fast, but it's like sprinting. It's best as a jump start with medical supervision. Now let's talk about Orlistat. Brand names are Xenical or Ally, and you can get this over the counter. This medication inhibits pancreatic and gastric lipases, blocking 25 to 30% of fat absorption. The average weight loss is usually around 5% or so, and common side effects are bad. Oily stools, flatulence, fecal urgency, especially with high-fat meals. And essentially, this can also reduce the absorption of fat-soluble vitamins. So it's important to take a multivitamin with this medication, follow a reduced fat diet to minimize side effects. And this one teaches portion control by essentially feedback. If you eat too much fat, your body reminds you quickly because you're not able to tolerate it. Qsymia, which is a combination therapy of phentermine as well as topiramate. And this medication enhances satiety and reduces cravings via GABA modulation. The average weight loss is up to 9 to 10% at 1 year. Common side effects include paresthesias like tingling, numbness, dizziness, insomnia. Some patients have a brain fog, dry mouth, constipation. And this medication is teratogenic, so you have to avoid this in pregnancy, and you have to taper this medication to prevent seizures. The combination is powerful, but it needs monitoring, especially in women of childbearing age. Then we have naltrexone and bupropion, also known as Contrave. And this medication targets the hypothalamic appetite center and mesolimbic reward system. Bupropion is a dopamine and norepinephrine reuptake inhibitor, and it curbs hunger, boosts energy. Naltrexone is an opioid receptor antagonist, reduces reward-driven eating. The average weight loss is around 5 to 8%, and common side effects include nausea, constipation, insomnia, headache, dry mouth. And this medication can also increase your blood pressure and heart rate. So you want to avoid this medication if you have uncontrolled hypertension, seizure disorders, or if a person's on chronic opioids. Now, Contrave is excellent for people who struggle with emotional or reward-based eating, but the blood pressure needs close watching. The next medication is liraglutide, or Saxenda. And this is a GLP-1 receptor agonist which mimics the incretin hormone GLP-1, slowing gastric emptying and signaling fullness to the brain. And it's dosed as a daily sub-Q injection, up to 3.0 milligrams a day, and the average weight loss is around 8 to 10%. Common side effects include nausea, vomiting, diarrhea, and constipation. And we'll see this in a lot of medications. Also, rare complications include pancreatitis and gallstones. It works by helping the brain say, "I'm full." The key is titration. Start low, go slow, and it also improves blood sugar and cardiovascular markers, so that's important. Next up is semaglutide, also known as Ozempic or Wegovy. And this medication is also a GLP-1 receptor agonist, but longer acting, and you give it once a week by injection. The average weight loss is around 12 to 15% of baseline weight, and it's one of the most potent among currently approved meds. Side effects, again, include nausea, vomiting, reflux, fatigue, and rarely pancreatitis, gallbladder disease. It may also worsen diabetic retinopathy in some patients. Contraindications include a family history or personal history of medullary carcinoma of the thyroid or MEN2 syndrome. And this medication changed the landscape, but remember, it's not magic. When you stop it, appetite signals can return unless lifestyle habits are in place. Next up, we have tirzepatide, Zepbound. And this medication is a dual GIP and GLP-1 receptor agonist, meaning it targets two incretin hormones for amplified appetite suppression and improved insulin sensitivity. The average weight loss is around up to 20%, which is close to bariatric surgery outcome, so that's wonderful. Common side effects include GI upset, nausea, diarrhea, fatigue, and rarely pancreatitis and gallstones. Zepbound is the new kid on the block, and it's impressive, but we still need long-term outcome data on sustainability and safety of this medication. Now, medications aren't magic pills, they're tools. You have to combine them with nutrition, exercise, and mindset. Monitor regularly with your physician. Track blood pressures, heart rate, and mood, especially early on. And always screen for contraindications and pregnancy risks. The goal isn't just to lose weight. It's to reclaim health, confidence, and longevity. And obesity care is healthcare, and you deserve evidence-based treatment. If this episode helps you understand anti-obesity medications, share it with someone who's struggling on their journey. And remember, it's not about perfection, it's about progress. Let's make wellness great again. Until next time, stay strong, stay healthy, and stay human. Thank you for listening.